Hi, family. Welcome back. We are excited to start season 3 of the Gold Corner. For the ones that don't know me, my name is Joel Ojeda. I'm also known as the Bearded Rev. And I created the Gold Corner. First of all, I created in memory of my daughter, Mia, who passed away in 2018 from neuroblastoma cancer. And I also created this channel as a platform where we can speak to other parents that have gone through the same thing that I went through. Parents that are going through the same thing that a lot of us are going through. So I just wanted to kind of make this channel again as a platform where we can see the reality of what childhood cancer is, what it's doing to our children, what it's done to our children, and what we are doing now as parents to be advocates. Of course, none of us wanted to be cancer parents, and we were not cancer parents until they told us that our child had cancer. And at that point, our life just kind of did a complete 180, and we were tossed into something we didn't want to be a part of. So I just wanted to say thank you so much for joining us. This is the Gold Corner, season 3. Let's do this.
And now it's time for the main event. This is the moment you have all been waiting for. In memory of Mia Ojeda, dedicated to all the brave little warriors that have fought and the ones that are currently fighting childhood cancer. For the thousands watching around the world, fighting out of the Gold Corner, it's
Today, I'm very excited to be to have our guest for this week. And back in June, I went to a gala in Las Vegas where I was one of the keynote speakers. And it was an amazing event put on by Lindsay Lacari from Aiden's Army of Angel. And in this event, she had angel moms that were there, and she was honoring these angel moms. And this is where I had the opportunity and the pleasure to meet our next mom. And Miranda and I actually got to talking. We got to know a little bit more about each other, a little bit more about our stories and everything that we've gone through. And I asked her to be a part of the Gold Corner. She agreed. So now we have here, I want to introduce to you all the Gold Corner family. I tell people we are a broken family, but we're broken together. I want to introduce Maranda Melvin from Minot, North Dakota. And she's going to be sharing with us the story of her beautiful warrior Phoenix. So Miranda, I just wanted to say thank you so much for joining us. Thank you so much for agreeing to be a part of the Gold Corner. It's very good to see you again, and we can't wait to hear your warrior story. So Miranda, the floor is yours.
Hi, thank you. So my son Phoenix was diagnosed with T-cell acute lymphoblastic leukemia in September of 2019. And just previously before that, we had gone through a stressful situation. I had ended a 6-year relationship and just moved in to my new apartment with my kids. And during the moving process, I had noticed that he had some swollen lymph nodes. And at the time, he was no symptoms other than that, no fatigue, nothing. So I just kind of kept an eye on it and kind of did a quick Google search. And, it said if you're fighting something off or if you're stressed out. So I was like, oh, he's probably just, fighting something off. And then maybe about 2 weeks later, I noticed that they were getting a little bit bigger. And that was where it kind of like really stuck in my mind. And I was like, I'm going to take him to the doctor if they change anymore. And then about a week later, he woke up and his voice was just different. Like it sounded like he had something stuck in his throat. So I took him to the walk-in clinic because it was a Saturday. And they almost immediately wrote it off as strep throat. And he didn't have any, strep usually comes with like pain and fevers and all that kind of stuff. He didn't have any of that. And they did do a throat swab on him. but she came back within 5 minutes and she said, that's the fastest I've ever gotten a positive back. He has strep. And I still to this day wonder if they actually waited to see if it came back positive or not. I suspect that they didn't. I've never had one come back that fast. I suspect that they just thought it was strep and were trying to send us on our way. And I said, well, but he doesn't have a fever, no white spots on his tonsils, nothing. And she said, well, sometimes people can just be carriers of strep. So their symptoms aren't that bad. And I said, all right, like, I'm not a doctor. What do I know? So we went home, we did the antibiotics. And I remember on day 3 or 4 of antibiotics, his lymph nodes and his tonsils had gotten significantly larger. And he was actually having a hard time swallowing food at that point because everything was so swollen. And so I called the nurse line and I said, look, like, he's been on these antibiotics for 3 or 4 days. Like, shouldn't they be at least reducing in size at this point? And they kind of brushed me off, made me feel crazy, like, oh, you just need to calm down and finish the antibiotics. So I said, all right. And one thing about our family is we're very like holistic, natural. So this is when I started like kicking up like all the natural remedies that I knew to try and kick what I thought was this strep throat. And we finished the antibiotics on like a Thursday or a Friday. And I said, if he's not better by Saturday, I'm taking him back to the walk-in clinic. By Saturday, he wasn't any better. He was still symptom-free, but there was so much swelling in his throat that he was having a hard time swallowing food. So I took him back. I said, I don't know if he needs stronger antibiotics or a different kind or what, but something's not right here. And at no point in time did I think it was anything more serious than some sort of infection or something. I just thought they had given him the wrong antibiotics or something. So they did some lab work and tested him for like mono and, all of his levels and stuff, which interestingly, at the time supposedly came back normal, which comes into play later on. So his blood at the time was not showing anything of concern. But the doctor that we saw that day, the pediatrician on call, about 5 minutes after we left, he had called me and said, hey, I just want to cover our bases and just be really thorough. It's probably overkill, but I want to do a chest x-ray just to see. And that I remember in my mind, I was like, they're looking for cancer. I just had this epiphany of like, I just knew. And so I took him to get the x-ray. And at work, it took them a day and a half to call me back. And it was Monday morning at work. And the nurse called me and I had missed the call because I was at work. So I called right back and I got the nurse and she wouldn't tell me over the phone what was wrong. She said, well, we need to wait for the doctor to call you back. And I said, well, why can't you just tell me? Like, I don't understand. And she said to me, oh, well, some of the findings in here are just kind of out of my scope. So we just need to have the pediatrician go over it with you. And so that right there sent like alarm bells off for me. And I was like, okay, like they must have found something. So the doctor called me about an hour later and he was very, very dry, very cold, very like, just no emotion whatsoever. And he said, so we got the x-ray back and there is a very, very large mass in his chest, which more than likely means that he has lymphoma. And I was just like, what do you mean? Like, he's like completely healthy. The kid's never even had Tylenol before. Like, what do you mean he has a mass in his chest? And I asked him, I said, can we redo it? Like, is there maybe something went wrong with the x-ray? And he said, no, it's very clear to us that he has a large mass in his chest and he needs to be taken to the Fargo Children's Hospital immediately. And that's 4.5 hours away from where we live in Minot. So I'm at work. I have 2 little girls in daycare. He's in school. He had just started middle school a few weeks prior. So I'm like a crazy person trying to like make all these arrangements. And so I get everything arranged. And Phoenix and I drove down to Fargo. We got there at like 9:00 at night. And they had a room ready. They were waiting for us. And at the time, he was 11. So he was aware that like, okay, this isn't normal. What's the deal? So I told him, I said, they just want to do more testing to figure out why your lymph nodes and your tonsils are so swollen. And he said, okay, he was super chill. And so we got there and they immediately started with poking and prodding and IVs and got him all set up to do a biopsy the next morning. And I remember the doctor on call, she was covering for what would become our oncologist, who was a few days shy of coming back from maternity leave. So she was pretty much on her way out. And I asked her, I said, what are the odds that this is not cancer? Like, could it be something else? And she said, we can never give a definitive diagnosis without a biopsy, but I'll be upfront and honest with you. I'm 99.9% sure that your son has either leukemia or lymphoma. And I started crying. And she said, don't cry. You don't want to scare him. And I said, okay. So I sucked it up. And so the next morning we went and did his biopsy. And the whole time he was so chill. Like he just was going with the flow. Like I think he knew something was up, but he didn't know enough to really be scared. And so we did the biopsy and they sent us home. So we stayed another night in the hospital. They sent us home and they said, it could take 3 to 4 days to get the results back. Why don't you guys go home? We want you to be comfortable with your other kids. So we made the 4-hour drive home. The second that I pulled into my apartment complex, the hospital in Fargo called and said they had gotten the biopsy report back. And they said, can you come back right away? And I said, I just got home. Like I just drove 4 hours. And they said, okay, we'll give you 48 hours. Like get your arrangements together and you need to come back. And so at that point, I was already aware that he had cancer. And I had told a few close family members, but we had not told him yet. So I got everything arranged. We went back down to Fargo and we did PET scans, CTs, all kinds of stuff. And they did more blood work. And that was the day that we met with the oncologist when she had everything in. And I remember her showing me his PET scan and there was cancer all over his body, all over, which with leukemia, it's hard because it's a blood cancer. So it spreads to all your organs. It's in your bone marrow. And so we had to sit him down and tell him that he had cancer. I remember his first question, he started crying and he said, am I going to die? And I wanted to always be very honest with my son and never wanted to tell him, oh, everything's going to be fine. Like, because I didn't want to give him a false sense of reality. And his oncologist, she was so amazing. And she looked him in his eyes and she said, if I ever think that you are going to die, I will be honest and I will tell you. She said, but at this point, like the kind of cancer that you have is the most common childhood cancer. It has very high success rates for treatment. And we're gonna tackle this, and we'll be honest with you every step of the way. So his labs had come in while we were at that appointment, and they were so critical at that point that they cut the appointment short and sent us immediately to the pediatric intensive care unit. And, you know, just a week prior in Minot, they had been fine. So this was like all very fast, very whirlwind. He was still acting completely fine. So I just was really like shocked by everything. So we went to the PICU, and we got settled in, and the next morning the doctor came in and she said, I know your son doesn't seem sick, but he's very, very like critically ill. And the next like 48 hours are going to be crucial to see if we can get his white blood cell count under control. At that point, he was too like critical to have a port placed. So we had to do a PICC line for our first round of chemo. And at the time, he was too sick to start chemo either. So they just went ahead with just the steroids. And they immediately started turning things around. Within maybe 48 hours, his lymph nodes and his tonsils were almost back to normal. And before that, when they had admitted us into the PICU, they had numerous doctors and nurses coming in and taking pictures of his tonsils and his lymph nodes because they had gotten so big that they could not believe it. They'd never seen anything like that. So for it to turn around that quickly, I was really encouraged. And one part of our story that's pretty unique, like I mentioned earlier, is I am very holistic. I raise my kids very, very natural. We don't do medicine. We don't go to doctors unless it's like life or death. We just eat very, very healthy, no vaccines. So for us, the chemo was a really big deal. That was something that weighed really heavily on me. I felt like I was in this place of like, wanting to take time to kind of process and research and understand like how these medicines are working, what they're doing to his body. And at that initial appointment, after we had gotten the phone call about how sick we was, everything was very rushed. And the doctor said, I need you to sign these chemo consent forms. And I said, I can't sign anything right now. Like, I'm a mess. Like, everything's happening so fast. I need time. And she said, I don't want to have to do this, but if you don't sign the papers, we will have to get CPS involved. So that right there, I felt very backed into a corner. And when it comes to pediatric cancer, you really don't have a choice. Adults get the choice to decide whether they want to do chemo or natural or whatever it may be. And I may have came to that decision on my own, but it's the fact that I wasn't given even 24 hours to think about it. So that right there, I kind of got in my head at that moment, like, I'm the parent, but I don't really have a say in much of this. And that kind of was like an ongoing thing throughout our journey. So he started doing really well on the steroids. And then I think maybe a week or two after the steroids, I'm not quite sure, but we started getting chemo on board. And he did really well with the chemo. We were really fortunate. He didn't have really any nausea. For the first couple of rounds, he was eating really well. So I in my mind, I had this idea of like how horrible things were going to be. And they just weren't. And I remember saying to his doctor, I was I was so like, oh my gosh, like this is so much easier than I thought it was going to be, you know, like he's doing great. Like we're going to be fine. And I remember her telling me like, there's what we call a honeymoon phase and pediatric cancer. And you guys are in the honeymoon phase. And she said, I don't ever want you to think I'm being negative, but I just want you to know that at some point things will get bad. And I was just kind of in denial. And I was like, not my kid, like he's doing great. So at the time they discharged us from the hospital, but we weren't allowed to go back home because it was too far away. They didn't want us being 4.5 hours away until he was done with at least his first round of chemo, which is several weeks. So we stayed at the Ronald McDonald House, which was right next door to the hospital. Our experience at the Ronald McDonald House was nothing short of phenomenal. It was a brand new building. It was so nice. I mean, nicer than most like hotels. It was a beautiful, beautiful building. The staff there was incredible. So for me, that experience was great. It still wasn't home, but it made things easier. And he was sent home with a PICC line. So I all of a sudden turned into a nurse. I was flushing lines and sterilizing things. And, you know, they give you one quick demo in the hospital and then send you on your way. And I remember we had a dresser, a whole dresser drawer full of all these things to like flush his lines and meds and all this other stuff. And it really was just overwhelming, and you're just thrown into it. And I think a lot of times the nurses and the doctors are so used to that. And it kind of gets lost in the parents. Like, we're not used to this. This isn't a life that we're used to living. Like, I'm not a nurse. I don't know how to do any of this stuff. And so Phoenix and I just kind of learned along the way how to do that. And so we did some appointments at the cancer care center, and things were going really well. And his hair didn't start falling out until right about the end of the first cycle. And I think for both him and I, that was kind of like, oh shit, like this is getting real. Because before that, he had been doing he seriously had no side effects from the chemo. He was totally himself. And I remember him getting up one morning, and I had looked over at his pillow, and there was a bunch of hair on his pillow. And I was like, oh my God. And I didn't point it out to him because I didn't want to scare him. But I remember taking a picture of it and sending it to my mom. And I was like, it's getting real. Like, this is really real. And that was like one moment that just really sticks in my mind of like, holy crap, like this is what we're doing. And he got in the shower the next day. And when he was done, he was yelling for me, mom, mom, mom. So I'm thinking something's wrong. I come running in there, and there was just hair everywhere. And he was crying, and he said, I just want to shave it off. And I said, you don't want to do anything fun with it? And so at the time I was going back and forth because I still had 2 little girls 4.5 hours away. So he decided when I was back with the girls that he was going to get a mohawk instead of just shaving it. So his grandma took him to get a mohawk, and he loved that. And so, I mean, for the first several weeks, things were fine, pretty easy. The chemo appointments were really, really long. Like those days were long, and I was going back and forth trying to still see my other kids. And so about November, early November, we started round 2 of chemo. And this round was some oral pills and also some shots at home. And I believe it was cytarabine that were the shots, and it's not a fun one. It's not a fun chemo. And that was the first time that he started having any symptoms. But for him, it was that his platelets plummeted like almost overnight. And I remember we woke up and he just was pale and had circles under his eyes. And I was like, okay, like this is taking a toll on his body. But again, still nothing unmanageable. So we just kept trucking along. And his younger sister's birthday is mid-November, and he hadn't been home since mid-September. And all he wanted to do was be home for his sister's birthday. So bad. So we had got approved to go home for that because we were almost halfway through cycle 2. And so a couple days before we left, he had started saying that he had really bad headaches and he was just totally drained, lethargic, not himself. And I called the oncologist team 2 or 3 times, and I was like, he's just not himself. And they said, well, we're getting further into chemo. This is to be expected. And I was like, I don't know. This just seems like pretty drastic change all of a sudden. And they just kept assuring me that it was fine. So we drove home for his sister's birthday, 4.5 hours. And I remember that drive home, he sat in the back of the car with his sweatshirt wrapped around his head, just in agony. And towards the end of the trip, started throwing up, which to that point, he had not thrown up at all. And so I just was feeling very on edge and uncomfortable. But he was really happy to be going home and seeing his sister. So we got there that night, the night of his sister's birthday, and he was just exhausted. So we made him a spot on the couch and we were doing presents and dinner, and he didn't want to eat. And about 2.5 hours after we had gotten home, he started running a fever, which in the pediatric cancer world is no good. And that was the first time for me where I had really broken down, because I was like, damn, like we just got home. Like, can we just catch one break? So I had to take him to the emergency room. And in Minot, our emergency room is not equipped to deal with pediatric cancer patients. They deal with adult cancer patients all the time, but his oncologist in Fargo did not want Minot dealing with him at all. Basically, just get him in, start him on antibiotics, and we'll get him to Fargo. So we got there, and his oncologist had called ahead of time and made sure we weren't going to have to wait or anything. And when we got there, they were so rude, didn't have a room ready for us. The nurse was just awful. And so I ended up having to go into like mama bear mode. And I was like, my sick kid, he is immune compromised. We are not going back out in that waiting room. I don't care if you have to, put us in a room on another floor. I'm not going back out there. So our first time getting into the hospital was just kind of a disaster. So we got in, and they told us that we would have to either be life flighted or do ground transport back to Fargo. And they said, oh, our plane is broken and there's no ground transport available. So you're going to have to put him on a helicopter by himself. And mind you, it's like, I don't know, like 11 o'clock at night at this point. They wanted me to put him on a helicopter by himself and drive 4.5 hours to Fargo that night. And I said, absolutely not. And I fought tooth and nail. I said, you will find another solution. That doesn't work for me. I'm not putting my son on a helicopter by himself. He's sick as heck. Not doing it. So I remember one of the nurses came in, and she was so phenomenal and she was so caring. And she got down on her knee and whispered to me, and she said, you have options. They just don't want to tell you. She said, ask ask for the other hospital to send their plane to come and get you guys. And she said, don't tell anyone that I told you that, but you have options. So when they came back in, I said, well, what about if they come and pick us up? And all of a sudden, within 10, 15 minutes, oh yeah, we'll get you guys all set up. And I was furious. I said, so I had an option all along. You guys just weren't going to give it to me. And no one had anything to say, and so we got life flighted back to Fargo. And it's standard protocol when a child has a fever that they automatically do labs and start checking for any kind of infection, bacteria. Well, when we had gotten to Fargo the next day, his labs had came back and he had gone septic with meningitis or meningococcal, which is a super rare, like that's very, very rare. And it's also something that like has to be reported through the health department. And that's like one of the things that they vaccinate for and try to keep at bay. It's very, very serious. And so we had to go through all of this stuff with the health department, trying to figure out where he got it from. And they never could trace any way that he got it. And what they think is that some people naturally carry that bacteria in their sinuses. And they think that because he was so immune compromised, that he basically got sick from his own bacteria in his body. That was kind of the closest to an answer that we could ever get on that. So they started him on different antibiotics. And within a couple of days, he was perfectly fine. And then kind of, went about our treatment and stuff. By then, his biggest thing was he was constantly struggling to keep his platelets up. He was having just horrific nosebleeds. I mean, almost to the point of hemorrhaging. And those really scared him. I mean, they scared me too. It was just pouring. And I remember we would be in the hospital and they would just leave us to deal with it on our own. And it seemed like a lot of blood, and they were just never really concerned about it, but they really, really scared him. And at one point he had really bad blood blisters all over his lips. But luckily he never got sores in his mouth or anything, but he was basically bleeding out into like the outer layer of his skin and his lips. So that was really our biggest struggle, was just constant platelets. I mean, every appointment we were going through bags of platelets and multiple blood transfusions. And so at the start of his second round of chemo, they had put in his port, which they really sell it to you like sunshine and rainbows. Like once your kid has a port, it's great. They can go swimming and take baths, because when you have a PICC line, you can't do any of that. And, it's one central access point, no more pokes. And they really made it seem like this great thing, which for him, it was not. It was extremely painful every time he had his port access. I remember the first time he had it access, they had painted it to me like it wasn't going to be painful. And so I had told him it wasn't going to hurt, and it hurt a lot. And that was at that point in time when I really was like, I have to be so careful about what I tell him, because he was mad at me for several days after that, because I had told him that it wasn't going to hurt, and it did. And his port access was really the only other thing that we really struggled with. Every chemo appointment, it got worse and worse. He had so much trauma and would get really, really worked up. And, he was older. A lot of the distractions that they would try to use didn't work for him. He's like, yeah, right. Like, I'm 11. A tablet is not going to distract me from you accessing my port. So what we started having to do was, it got so bad that we would have to give him Valium before his appointment and then used nitrous oxide during his port access. So he was completely out of it, but also still fighting his port access. So that was just a whole source of just really crazy trauma that like you don't even think about or know about until you go into it. And chemo days and port access days have become just the bane of our existence. And so he was doing okay aside from the platelets and the port access. Other than that, he was doing really good. He would get tired sometimes, but other than that, he was fine. So they let us go home for Christmas. We actually got out of the hospital at like 5:00 on Christmas Eve. And so I was like, I'm getting my kids home for Christmas if it's the last thing I do. So I drove, mind you, it's a 4.5-hour drive. We didn't get home until 9-10 o'clock at night, put them to bed and started getting into Christmas mode. I wasn't working at the time, very low on funds. And we had phenomenal people and organizations that donated to us so that my kids could have a Christmas. So I started wrapping stuff up, and I remember the next morning I took a lot of family pictures. And at the time, I didn't think much of it, but I just remember that I really wanted to capture these times. Like they were so much more important to me now than they had been previously. And I'm so glad I took those pictures because we ended up not having much time after Christmas and things just kind of spiraled out of control. But one of my favorite pictures is the picture that I took on Christmas. And it just really makes you think like you just never know what's going to happen. So the day after Christmas, he had spiked another fever. And so I had to take him to the hospital again. And in North Dakota, our winters are rough. And we get a lot of snow, negative 50-degree temperatures. And at the time, we were in the middle of a statewide massive blizzard, to the point that they couldn't fly him and they couldn't ground transport him. All the highways were closed down. So we had no choice but to be admitted to Minot Hospital, which his oncologists were not happy about, but there was no way around it. So we got admitted to the hospital here, and they got him started on antibiotics. And right before, so we were there for 3 days. And right as we were leaving to go to Fargo, his results came back and he had septic E. coli. And what they think happened is that chemo breaks down your gut barrier and the bacteria in your stomach can leak into your bloodstream. And so they think that's what happened. So we got to Fargo, got him on antibiotics again, and he was great within a couple of days. At that point, his ANC or his counts were at 0. And they would not release us from the hospital until his counts came up. I can't remember the specific number, but there was a specific number that they wanted him to be at. I want to say it was maybe like 15, and he was at 0. And so we were just hanging out, waiting for these counts to come up, and he was at a break in his chemo. So we had finished round 2, and we were waiting to start cycle 3. So we were just hanging out, chilling, and he started saying that his chest was hurting. And like he would get out of bed and he would just double over in pain, and he was having a harder time breathing. So they did some chest x-rays and they said that he had pneumonia. And so he was put on like just a normal oxygen mask. And we did that for a couple of days, and it just kept getting worse to the point where he could not even get out of bed. He was screaming in pain. So then they started him on morphine and basically just kept saying, this is pneumonia. And I said, I have never seen someone in this amount of pain from pneumonia. Like, there's got to be something else going on. And they just kept saying, no, it's pneumonia. That's all we see. And so one night we were sitting in his room. And at this point, he spent all of his days curled up in a fetal position with an air mask on his face, just the illest I had ever seen him. And I remember he started talking about dinosaurs in the room. And I said, buddy, what are you talking about? And I realized that he was hallucinating. And so I called the nurse and I was like, I think he's hallucinating. Like he was talking about spiders on the wall and dinosaurs and aliens in the room. And the nurse came in and heard him saying those things. And so she ran out of the room to get the doctor. And in that time, he had then lost control of his bladder. So he just started peeing all over himself, which, especially at 11, that is very concerning. So when she came back in, things went really fast. The doctor came in and ordered a CT scan and moved us over to PICU. And they had then put him on, I believe it's like forced airflow, where it's higher airflow to help his breathing. And they did the CT, brought him back up, got him hooked up to everything. And I don't know, maybe an hour or two later, they came back and said that they had found 3 really large lesions in his brain. And I remember I was like, okay, what are they? And they said, we don't know. And that was really hard. They were working night and day, round the clock, figuring out what was wrong, but it took time. And the waiting just killed me. And he just kept getting sicker and sicker. They ended up intubating him because he could not breathe on his own anymore. He had lost all control of the right side of his body, really similar to a stroke victim. And before we had intubated him, he had pretty much lost the ability to talk as well. So whatever was happening in his brain was progressing really quickly. And I remember they sat me down in this room with these computer screens and pulled up the imaging and were showing me the lesions in his brain. And they said, from our best guess right now, we think that he's relapsed on his leukemia and that it's moved to his brain. And at that point, I was petrified. They were talking about brain radiation and bone marrow transplants. And, my first question was, is he going to recover the abilities that he's lost? And they said, there's no way of knowing until he gets better. So for about a day, I thought he had relapsed on his chemo. Or his cancer, even while on chemo. And that's super rare. It does happen, but it's really rare. And then they got an infectious disease doctor involved because they wanted to rule out it being some sort of infection. And the infectious disease doctor said, these aren't like cancerous. These are definitely some sort of fungal infection. And so at that point, it just was like, every time I would get an answer, they'd be like, oh, wait, never mind, and take it back. So it was like, I'd like come to terms, or not even have time to come to terms with things, but I'd be like, okay, this is what we're doing. And then the next day at rounds, it was something totally different. And it wasn't anyone's fault. It was just so complex. But it was just this constant, like, not ever really knowing what was going on and just back and forth and waiting. And it was really, really stressful. And so they did more scans, full body scans, and they saw that his right lung had completely, they said it had filled with fluid. And then they also saw lesions in his liver and one of his kidneys and in his stomach. And so at that point, we kind of realized, like, okay, this is like all over his body. And so the infectious disease doctor said, we need to figure out what this is. We've got to do a biopsy. And he said, we can either do a brain biopsy, where the most infection is, or we can do a liver biopsy, which is much less risky and, less invasive, but that the liver is less affected. So we may not be able to get answers. And, doctors always want to do the least invasive first. And I remember telling them, I said, why can't we just do the brain biopsy? Just go straight to where we need to and get our answers the first time around. And no doctor was on board with that. So we did the liver biopsy, waited several days. It didn't grow a culture. So we had no answers from that. So we had then put his extremely fragile body through an unnecessary surgery that didn't give us any answers. So their next idea was to basically do like a bronchial, like they rinse out the lungs and collect the gunk in his lungs and culture that. And again, I said, well, I don't understand why we can't just do the brain biopsy. Like, we're wasting time trying to find answers the least invasive way, but it's not working. And in the meantime, he was wasting away. I mean, he was, at that point, he was now on a feeding tube. He was very, very, very skinny. I mean, all his muscles were like atrophying. And I mean, I remember his calves were this big around. So skinny, just wasting away. And he was still intubated, which they never want to keep a patient intubated for very long. And he had been intubated for like over a week at this point. But again, they decided to do the bronchial procedure instead of doing the brain biopsy. And so we waited a couple of days for that. Still no answers. The culture didn't grow anything. And so then we decided collectively to do the brain biopsy. And the pediatric neurosurgeon actually did not want to do the surgery. She wanted us to keep trying to find answers other ways. And basically me and the rest of the team were like, this is like vital. Like, we have to figure this out. So she ended up doing it. So he came back up from surgery and had a huge scar incision across his head. And they had also put chest tubes in to drain the fluid out of his lungs. And he just looked, he truly looked like a corpse laying in the bed. He was unrecognizable. And at the time, I was still having to go back and forth and see my other kids. And I left for 2 days to go see my other kids. And I would do this every other weekend. And normally when I would come back, I would be ready to get back, missing him, wanting to see him, wanting to jump into rounds and tackle everything head on. And I remember laying in bed the night before I was supposed to go back to Fargo. And I was just so filled with just this dread that I could not explain. Just sheer anxiety, and I wanted to just run. I remember saying, God, I just want to disappear right now. And I didn't know what I was so scared of, and I didn't know why I was feeling like that, but it was so heavy. And so next morning I got to Fargo, and I remember they were doing physical therapy with him, and they had him trying to stand up, and they had this thing hoisting him up, and a walker, and 4, 5, 6 people helping him stand up. And I remember that some of my family that was there visiting were so excited that he was able to stand up. And I remember I was sitting on the couch looking at him, and it was like tunnel vision. And I was like, I just had this epiphany of like, I don't think he's going to get better. And I remember being so sad for him that he was working so hard just to even stand up. And right after that physical therapy appointment, his team of doctors came in and pulled me to the side and said, we got news of what this is. The biopsy came back, and it is a super rare fungal infection. It's mucormycosis, which is almost always fatal. I had already started looking into the potential infections that it could be, so I had already read about it. And it's got like a less than 1% survival rate when there's only one organ involved. And his was full body, brain involvement. And so the doctors basically immediately started him on antifungals, which they had already put him prophylactically on antifungals. They didn't have confirmation that's what it was, but the infectious disease doctor was pretty certain it was some sort of fungal infection. So he had already been on them, but once we knew it was the mucormycosis, we switched him to the one antifungal medication that has been proven to have any kind of effect. And so then we started having conversation about that we need to remove the organs that are affected with this dying tissue. And I remember we had this huge meeting room full of doctors, and they wanted to remove his entire right lung because the whole thing was just full of infection. And the room was pretty divided. And, some of the doctors said, there's no way he can go through that surgery. Like, it's just not possible. And some of the other doctors said, well, at least it's a chance. We have to get as much of the infection out as we can. But at the end of the day, he still had large lesions in his brain that we couldn't go out and take out. And the general consensus at the end of the meeting was that he would likely not survive that major of an operation. So basically, we just had to do the antifungals and kind of hope for the best. And, one thing about my experience that I didn't realize other people didn't have with their experiences. My team of doctors, they informed me every step of the way. They never sugarcoated anything. They answered every single question that I had. They just were so upfront and so honest with me. I always knew exactly where we were at, what our alternate plans were, what was happening. And at that gala retreat, talking with other parents, it became really clear to me that most people did not have that experience. They felt very in the dark, misled. And so for me, that's kind of one silver lining, is that our medical team, I could not have asked for a better team of doctors. And, they kept it really real with me. And I knew that we likely were not going to be able to beat the infection, but I was hopeful. I mean, he had lasted a lot longer than they anticipated with that kind of infection. So, and at the time I remember fighting with the dietitian. She kept coming in and, I just wanted to do the best that I could. I remember wanting to put him on donor breast milk through his feeding tube, because that's like the most nutritionally complete source that you can put in your body. And it's got so many healing properties. And I remember they wouldn't approve it, and they wouldn't let me do it. And I was just pissed. I was like, every step of the way with any supplements that I wanted to do, or anything outside of their box of treatment was scrutinized and looked down upon. And I had to have approval to give him anything or do anything. And I really felt like I didn't have any options as a parent. I didn't have any say-so as a parent. And that was really, really hard, because I remember just being so frustrated. I'm like, this is my child. It's my job to advocate for him. Like, he can't even talk. He is bedridden. Like, it's my job to keep him safe. And I felt like they wouldn't let me do that. So that was really, really hard. And again, with pediatric cancer, parents just don't really have a choice. When you're an adult with cancer, you can make choices for your own body. You can choose alternate drugs and things like that. And with kids, it's just not that way. And it's really, really traumatic for parents. And so even up at the end, I was fighting about what kind of formula they were putting him on, and just everything that they were giving him, and what can we give him and what can we do without. And, all the doctors were really nice, but it was just this constant battle of trying to like regulate what they were putting into his body. And so they had done some scans. They were tracking how his disease was progressing and whether the antifungals were working or not. And they had sat me down and said, they're not working. We're giving him the most that we can, and it's still spreading. And they had seen that at the newest scan, the fungal infection had eaten through his pleural lining into, so had gone like through his lungs, through his pleural lining, and had started eating into his spinal cord. So that was like the day that like they sat me down and said, it's a matter of keeping him comfortable at this point. And they said, do you want to take him home to Minot, or do you want to keep him here? And I remember asking, I said, well, how long do we have? Like days, weeks? And they said, well, once we stop giving the medicine, 24 hours, maybe 48. And there's just like not really anything in life that can prepare you for that. And I said, I don't want to move him. I don't want to waste time. I just want to be with my son. And whatever time we have left, I just want to spend it with him. And so they said, well, we suggest that you keep him on the medicine for a couple of days so that family can come out and visit and, you know, everyone can say their goodbyes. And so we did that. And he was awake bits and pieces here and there, but when he would wake up, he was in agony. So especially towards the end, he was pretty much kept asleep all the time. And so it came to a point where we had to make the decision to stop giving the medication. It wasn't doing anything anymore. And, you know, I had to make the decision to turn the ventilator off, because at that point it was just prolonging the inevitable, and he was just in agony. So I didn't want to make the process any longer than it had to be. And so his little sisters and I and my grandma and his grandma on his dad's side were all there, and they said, you know, it could be minutes or it could be hours. So we turned it off and we just sat with him and we spent time with him and we told stories and we held him, and he ended up passing that night. And, you know, he passed with his sisters and I curled up in bed with him, and they made sure it was really peaceful and comfortable. And I remember after that, they asked if I wanted to spend time with him until the funeral home came to get him. So I just crawled up in bed and I laid with him for like an hour until they came and got him, and they had to like peel me out of his bed. And I will never forget them taking him away. It was just like, no parent should ever have to see that. And, you know, with cancer, it's go, go, go and treatments and all this stuff. And I remember thinking, what now? Like, what do I do now? And so we had to go home, and, you know, I had friends and family and the community help me with planning a funeral and everything. So, but afterwards, and even when he was sick, I had gotten really into fitness. It was a way for me to escape and a way for me to just kind of release my emotions. And so afterwards, the gym was crucial to me, but then COVID hit. So he died February 4th of 2020. So just a couple weeks before everything shut down. And so here I am. My kid just passed. I have two little kids that I'm trying to take care of. They just lost their brother. Now I can't go to the one place that makes me feel even just a little bit like normal. And on top of that, all of the mental health services got closed down. So me and my kids just kind of got thrown to the wolves. There was no support. There was no services. It was just, and I get it, it was a crazy time. Like, it was a worldwide pandemic, but I remember just thinking like, God, like, forget about me, right? Like, my kids need help. Like, they saw horrible things that most adults can't even process. And I just remember being really frustrated that, like, it seems like no one cared. And so so I started working out at home and just processing and kind of trucking along the best that I could. And, further into the pandemic, maybe like 6 months in, I was able to get my oldest daughter into counseling, and she did really well and started thriving. I still have not done any kind of counseling or grief counseling or anything like that. By the time things opened up, I kind of just was at a point of like, didn't want to go back and rehash things. So for me, I just really focused on being the best version of myself that I could be. I made a lot of changes in my life, got rid of a lot of toxicity, just killed it in the gym as soon as I could. I tried to be the best mom that I could. And I started working with the foundation, the local foundation that had helped us so much when Phoenix was sick. And I started harnessing my fitness into giving back. So in April, I did a 5K, raising money for pediatric cancer. And this August, I'm doing a 5-mile mud run obstacle course to raise money for pediatric cancer. I'm very open on social media about our story and kind of life after losing a child. Because, it's easy on social media to make everything look fine. And I think it's important for people to see that this never goes away. It's something that you deal with for forever. And so I try to always be really real and authentic about that, while also talking about the good things and the people that I've met. And I've met some of the most amazing people through Phoenix's journey. And I saw the good side of humanity. I saw people who wanted to help. I saw people who cared about a family they had never met before. And it was really good for my kids to see that too. So I try to really focus on the good things and pour myself into my kids and giving back in ways that I can. I donate blood in his honor. I donate meals to the Ronald McDonald House. So for me, giving back in his honor has been really healing for me. That's been the gym and giving back have been my biggest saving graces.
Well, I know you and I had an opportunity to talk a little bit in Vegas, and you did mention, some of the things, but I'm hearing this just as all our viewers are hearing this for the first time. I'm hearing this for the first time too, in depth, and this far is in detail as what Phoenix had to go through. And it's like you mentioned, it's something that we carry, and that's something that we're always going to carry. And not a lot of people will understand us. And if they don't understand us, that's good, for them. It
Yeah.
means that they haven't gone through what we have. But I talked about it a little bit, and we talked about it also when we were in Vegas once. I mean, Lindsay brought together a group of people that we had never met, and 5 minutes into just being inside a limousine, we were all family because we all were there because we've all gone through the same thing, and there's those triggers like you were talking about. And I did
Mhm.
mention when I was speaking, one of the biggest things and one of the biggest, when your child is fighting through things, you almost don't think it's real. You almost want to say, no, it's not really happening. But one of those realities that slapped me in the face is the same one that did to you, and that's the hair falling off. That's when it reminded you, hey, this is real. Your child has cancer, and your child is going
Yeah.
through these things. um and we're always going to have those little triggers, whether it's going to be something little, something big. But this is the reality of it. It's not what you see on commercials. It's not what you see in these big name commercials of these little kids running around happy. No, childhood cancer is a lot more than that, and it's a lot more than people don't realize, and it's a lot more than people do not see, because I don't know, they don't want to show the reality of what childhood cancer is. But Miranda, I know you were talking about the local organization that you help out with. Is that the only organization? And if it's okay to name them, that way, people can look them up, and if they want to donate or do anything. And then you and I were also talking. I know that you in the future wanted to do something else. I know you have your own YouTube channel now, but you kind of wanted to integrate being an advocate for childhood cancer. So if that's something that is on plan right now, if you want to talk about it, if not, maybe in the future, we would love to partner up with you and help you out as best as we can. But is there any other organizations that you are currently working with, or you want to thank those organizations for what they did?
Yeah. So first and foremost, the local foundation is called Brave the Shave. And they help North Dakota families. So all their money goes back into local families. And they were pivotal in, I don't know what we would have done without them. They paid several of our bills for us. At the time, I was driving a little tiny Honda Accord in North Dakota where the winters are awful, and it was an older car and it wasn't reliable. And they actually helped us get into an SUV so that I could get him back and forth to the hospital safely. And they helped largely with expenses after the fact, because people don't talk about how expensive it is when you have a child, or anyone, I'm sure, die. It is really expensive. And when you're a mom of young kids, you don't ever prepare for something like that. I mean, that's not something that I ever thought that I would have to prepare for. So they helped with that. And they do tons of fundraising throughout the year that I'm always shouting out on my social media, and making sure that I'm getting as much traction for them as possible. Another resource that was phenomenal for me that I did not realize most people didn't have access to until we went to Vegas was our cancer clinic in Fargo has a social worker, not at the hospital, in the clinic. And her sole purpose is to hunt down any grants, funding, any kind of help that she can get for you to pay your bills. She did all the paperwork for me. Literally all I had to do was she would come in at my appointment with whatever foundations she had found, asked me to sign on the dotted line, and things were getting paid with zero effort on my end, which seriously has to be one of the greatest resources that I received, hands down. And if other children's pediatric oncology clinics don't have a position like that, they should. And that's one thing that I do when I start speaking out more about our journey and advocating. That's one thing that I have really decided that I want to really push is having someone in those clinics to do that, because it completely changed our experience. And then the other one is the Leukemia and Lymphoma Society. They helped a lot with travel expenses. Gas back and forth was not cheap. So they helped a lot with that. And then friends, family, people we had never met. Phoenix was a huge Ninja Warrior fan, obsessed. And Matt Eisman, the host of the show, for Make-A-Wish, had given him a video shout out, and we had posted it to social media, and all of the American Ninja Warriors in the community started giving back and raising money, and just making sure that his legacy was really well pictured and lived on. And that was incredible too. We were really blessed. We had a lot of help. And I've realized that not all other families have that. I think the financial aspect is something that gets really lost in the mix of things. And I think that's probably an area that I want to focus on when I get more into advocacy, is the social worker in the clinic and financial help.
Yeah, I think that's amazing. And yeah, I mean, there's not a lot of hospitals that have that position. And honestly, what a blessing for, for families to have that, because you want to fight with your child, you want to be there, but there's still those things in the back of your head, my phone bill needs to get paid, my house, my car, whatever. But when you have these people that are solely just dedicated on that helps out so much. The other thing that I did want to ask is, and very quickly, I know you touched on this for just a little bit, but the siblings. A lot of people, when a child is diagnosed, they fight, but the entire family fights and the entire family suffers. I do not know that part because I don't have any other children. Mia did have an older sister, but unfortunately now I just know about her, a little bit. So I know that she had some help, but and I also see pictures that I see your daughters in gymnastics. So I know that there's things that have helped your daughters now that they lost their big brother. They lost their big brother. So what has been the things that have helped you with your daughters? That's one of the questions that I had. And, and again, what has helped and what hasn't helped with your daughters?
So first and foremost, our Children's Hospital in Fargo had a phenomenal child life program. So they have specialists that not only help the kids that are sick, but they took my girls under their wings and they took them down to the playroom for me so I could spend time with Phoenix. When the time came that we had to tell Phoenix and tell his sisters that he was going to pass, their whole goal is to help children understand things at their level. So they sat down and had individual conversations with each of my girls, read them books about having siblings pass away. They gave me some resources after the fact, but then the pandemic hit. I would say for my girls, the biggest thing that's helped is keeping his memory alive. And everyone grieves differently. For us, the more we talk about him, the better. We have pictures of him everywhere. We talk about him frequently. And, I really include them in everything that we do to honor him. Whether it's taking a meal to the Ronald McDonald House or, they can't donate blood, but I tell them that I'm donating blood and I tell them why and why it's important. And I'm hoping that they can come and watch me do the 5-mile mud run in August so that they can see that there's ways to give back. And for me, I just want my girls to know that there's life after loss and that that you can keep going and that there's reasons to be happy and there's reasons to smile. And for my kids, my 3-year-old, she was really little, so she doesn't really have the memories and the trauma that my 7-year-old does. For my 7-year-old, grief counseling has been phenomenal. She was having a lot of behavioral issues that you would not necessarily equate to loss. Hyperactivity, fidgeting, loss of focus in school, and a lot of the issues that she was having drastically improved when she went into counseling. And then, the gymnastics. So that actually was our counselor got us a grant to pay for her gymnastics for the summer so that she can kind of reintegrate with kids and learn how to kind of control her body and her feelings and, all that kind of stuff. So it's been really, really good for her. And, my kids have been so resilient. They've done really good, and I'm super proud of them. And when they have hard days, they have hard days. And I make sure they know that's okay too. And I make sure they know that I have hard days, because it's not always rainbows and sunshines. I do try really hard to be positive as much as possible, but I want them to know that it's okay to be sad. It's okay to be mad. So that's what's helped.
Yeah, and I see that you're doing an amazing job. And again, I know that you just came back from a trip, and I knew that that was a much needed time for you and the girls. And I also saw the pictures; they were heartbreaking yet beautiful. Of the pictures that of you and your daughters in Phoenix's gravesite. So, yeah, that's just the reality of what we have to live now. So, Miranda, before we leave, I do have two questions that I always ask my guests when they are here. And I'm going to ask you those two questions. The first one is going to be, what do you tell other parents that are in the same situation that you and I are, having lost a child? The second question is, what will you tell parents that have perfectly healthy children? And then anything else you want to leave us with before we finish?
Um, the parents with perfectly healthy children really hits home for me. Like I said, I did everything I thought to keep my kids healthy. Gluten-free, dairy-free, all organic, no vaccines. And what I always tell people is balance. You got to live life sometimes. So I really learned to balance and just let my kids have fun sometimes. But my biggest thing is don't take anything for granted. I've started, as you can see, you follow me on social media. I take pictures of everything. I document everything. I don't want to miss anything. And that was something with Phoenix. I hadn't taken a lot of pictures. Social media was not a big thing when he was born and when he was little. I don't have hardly any pictures. And so that's one thing for me. Just document it, enjoy it, make videos of your kids, take pictures. And hopefully you never ever had to have them for the reason that I do. But you'll never regret taking pictures and videos of your kids. And then what would I tell people that have also experienced loss? For me, I would say, really focus on finding something that helps you process your grief. For me, it was giving back, and giving back in specific ways that were important for our journey. Phoenix needed a lot of platelets and a lot of blood. So that's something that I do frequently, that every time I donate blood in his honor, I feel a little connected to him. And that's helped me tremendously. And it feels good, to give back and to keep his memory alive.
All right. Well, thank you so much, Miranda. Thank you. I know that you've shared your story in the past before, but I just want to say thank you for going into detail and everything that you had to go through with Phoenix and your daughters as well. So just again, thank you so much for being here. And to all our audience, this is who we are. This is, if you've been following my channel, if you've been following our stories, you'll see what us as parents have to go through, when it has to do with our children. We would do anything for our children. We did everything that we could for our children, and we still suffer. And it's something that's going to be for the rest of our lives. But this is our new normal. People are talking about the pandemic and the new normal. We started living this new normal when our child passed. So this is who we are in the Gold Corner. Again, we are a broken family, but we're broken together. Make sure to follow us, hit that little bell so you can be notified every time that we do upload a video. Subscribe to this channel. Check out our website also at thegoldcorner.org. We have a lot of great things coming up, especially for the month of September. Thank you so much for joining us today. And Miranda, thank you so much for opening your heart with us and sharing Phoenix's story. Thank you so much. This is who we are. We are the Gold Corner. Remember to live each day to its fullest, because tomorrow's not promised. And just hold on a little while longer, because we're almost home. God bless you, and we'll see you next time.